to, this idea of membership on local boards, commissions, and do have some level of awareness of behavioral health issues.
Okay, thank you.
Okay. She's got you.
Jessica?
How's my volume?
It's good, we can hear you.
Okay, thank you. So after our BHAB retreat, I went out into the community among my network and I spread the news about open BHAB seats and an open youth seat. And the feedback I got was that when they went to the BHAB website on the county website, the whole setup there doesn't seem to be accessible. Like we don't have vacancies listed. We don't have members listed. And it says that there's a box on the top right that you can click to apply, but there's no box on the top right. So since we're investing so much energy trying to recruit people and fill our seats, I think it would be really helpful if we made sure that when people go to the BHAB site and and are interested and are trying to engage or apply, that site actually has the information that is needed for a person to be able to apply. Thanks so much.
Definitely agree. Thank you.
I'm live
so much,
streaming the
Jessica.
Behavioral Health Advisory Board meeting in San Diego. She just confirmed a few things, that they had a private meeting. They called it a retreat. I don't know much else about it.
User friendly. Internally, as far as the BHAB website, we are currently developing a website design with one of our student ambassador liaisons. So it will be from a youth lens, and there are also different accessibility features being taken into account in the development of the BHAB website. So we're hoping to use that for challenge mitigation in recruiting youth members, and then there's also other members as a whole.
That sounds like a really bad idea. They're doing a student for a government website like this that has been dysfunctional for a long time.
But
This
again,
sounds like
to your
insider
point,
stuff.
Skylar, it is not exactly user friendly. I've been on there multiple times to make sure that it's up to date and things like that. It is there, but it's not exactly the most user friendly experience trying to apply and trying to see that, all of us are there because I've referred friends there. So yeah.
Yeah, and you're speaking to the clerk of the board website as well.
But I just provide that clarification if you want to start. Sorry. So I think as a point of clarification and distinction from this, and important to hear the feedback that you received, Jessica, is that there's the BHAB website where we have all the materials and information. And as Skylar mentioned, we are going through a revamp process that we've mentioned before at BHAB to make it more accessible, more user friendly with that lens. But when folks go to apply to be on the board, that's not on the BHAB website. We have a link that goes to the clerk of the board's website. So I think sometimes there is that confusion or misperception that they're going to the BHAB site, but it's actually everyone in the public, in order to apply to get on the board or commission in the county, need to go through the portal that the clerk of the board has. And so that's completely distinct from us, and always happy to provide that feedback to the clerk. But that is not a website that we've created or manage. And I have gone on it before, and I've noted as Sarita has, that there is some confusion about how the information is listed, how to go about applying, the roster, what seats are vacant.
This
It
group
isn't
is
always
almost
very
unbelievably
clear, but
self-referential.
just want to make that distinction so that everyone's aware and thank you.
At least half of their discussions are about themselves.
Do you have any comments from Dennis?
It looks like they have a decent crowd,
Oh, she's on. Okay.
maybe 20 people.
Amanda. Oh, okay. Go ahead, Bill. You'll do it.
This is my first webcast, so it's been a real mess. I'm doing it mostly to learn the technology. I don't expect anyone to actually watch this.
It's very soothing, supportive, and it allows the mentor to share their knowledge and the mentee to ease into it, have questions. When I first joined as a member, I had a mentor when I joined BHAB that supported me. So it wasn't a program set up, but the members took it on their own behalf to mentor me. So I think it's a beautiful idea and it will be very soothing and helpful.
You said the vendors took it on their own behalf to help
Thank
him.
you, Skylar.
I wonder
The
what
presentation
vendors he's
you did
talking about.
fantastic. Okay, the next item on the agenda is an action item. It is to vote on the slate for the 2025 VHAB officers. Okay, I need everyone's eyes and ears because this is going to be a mouthful. So I'm going to go as slow as possible.
They're voting on their
And
own
we are going to
officers.
talk fast, so please, if you have any questions, ask them when they are appropriate to ask questions, okay? Following, we're good? All right, here we go. The nominating committee is presenting the following recommended slate of 2025 executive officers. In front of you is the most recent slate of officers. So this is gonna be a 2-vote action item. The vote is going to be for non-contested and contested slate officers. Let's see.
Some group has
The first thing that I'm going to
decided
be
these
asking,
25
are there
people,
any
but they didn't say
nominations
how.
from the floor? For new officers? Anyone that wants to be added to the ballot? No? Going once, going twice. Fantastic. If you are attending via Zoom, please let Maria know that you are going to be adding your votes or send your votes via the Zoom chat to the host. That is very important that you send it to the host and don't just add it to the chat, okay? Following everyone on Zoom, send it to the host. Thank you. Okay, seeing that there are no other additions to the ballot, there was a paper that was handed out to everyone, okay? This is the ballot paper here. Eyes, I need eyes, everyone, thank you. So no one gets confused, this is the ballot paper. This is the ballot paper that you're going to be using to put in, okay? We're gonna be taking an oral vote and we're gonna be taking a ballot vote, okay? The oral vote is for the ones that are non-contested. The ones that are contested, this is the ballot vote that you're gonna be using, okay? And that is for the member at large vote. That is for Stuart Gaber and that is for Julie Hayden. I guess the last name right. Did I say it right? Fantastic. That's what you're gonna be using for this, okay? Or do I need to take a motion?
Yes, so,
Which one?
you want me to assist? Okay, so the first part of the vote will be for the non-contested slate, as Sarita said. So we'll go ahead and, call it a motion.
Okay, can I get a motion, please?
Motion to do the vote for the first slate.
Can I get a second motion, please? Fantastic. Okay. Admin, will you call the vote?
Yes. Bill,
Aye.
Gaurav,
Aye.
Joel.
Aye.
Julie. Aye. Sarita,
Aye.
Jessica.
I'm sorry, you guys, but the volume for this meeting, it's not just me, is just really difficult. It's just not that clear and it's very hard for me to hear what you all are saying. I'm really trying hard to participate. It's definitely not a failure of my willingness or anything like that, but if you guys, when you speak, could really try to speak slow and clear into the microphone in a way that's considerate of me not being able to see or hear that well right now, that would help me so much. And if you could please just reiterate what you're asking me to vote on, that would be great. But please speak slow and clear.
Currently, we are voting on the nominating committee instructions to offer election vote, and the nominating committee presented the following recommended slate for the 2025 executive officers. That's where we're at right now.
Okay, so you just want me to say that I agree to the current slate?
Correct, nothing changed on the slate.
Okay, great. Thank you so much. And that's a yes from me.
Robin,
I vote on all the existing nominees.
Holly,
Aye.
Seems like they decided all this before, maybe at their retreat.
Stuart,
Aye.
Judith,
Aye.
Amanda. Donald,
Aye. Aye. Excuse me.
motion passes.
Fantastic. Can I get a motion to vote for the contested seat via ballot?
Motion to vote for the contested seat on the ballot.
Second.
We have a discussion.
Go ahead.
Just wanted to close to the nominating people, being aware of the time. What do you call it, restraints, or the time commitment that is available to this position. Okay, just wanted to clarify that. Thank you.
Please complete your ballots with your name for VHS to collect, and please note your name will be reflected on the meeting minutes. Admin team will relay your results.
This is my first video stream. I'm doing it because I wanted to watch this group anyway at San Diego Behavioral Health Advisory Board. I probably should have just recorded it with my normal video recording. But I wanted to learn this technology anyway, so I'm doing it that way.
I thought we were.
Somebody second that?
Oh, wait, has everyone voted?
Yes, we're counting the.
I didn't do that one.
No. Everyone has not voted.
That's it right there.
I didn't know.
I wrote this group a few messages before. They did try to call on me to speak, but I didn't want to speak. I don't know how that how they made that assumption. I don't want to be a political prop for these guys. But basically, they decided some really important things without even people being involved at all. Like I said, it's a very, very self-referential group.
Well, we have to, Robin and, yeah.
I believe the director of the San Diego County Behavioral Health Department, I guess it is, will be on there.
Tally the count. And for the 2025 BHAB Executive Officers Ballot, for member at large representing the Alcohol and Substance Use Committee, we have 9 tally for Julie and 4 for Stuart. So, Julie will become our
member at large representing the alcohol and substance use
So they've
community.
counted the ballots already.
Thank you.
Alcohol and substance use. Boy, do I have a few things to say about that one.
Thank you so much. Thank you so much.
There's
Moving
no
on to the
practical
next
way to
action
use this
item,
group
which
to
is
provide
the
citizen input that
2024
I
data
found.
notebook.
They're mostly appointed by
Can I
the
call, to
San Diego County
approve
Board of
the data
Supervisors, I
notebook?
believe.
A motion, sorry. Can I get a motion? to approve? Move to approve the data notebook. And I second it. Call for discussion.
And 2 minutes to speak is ridiculous.
No discussion? Okay,
Okay. All
I
right.
think that's by design. They do not want
Bill,
public input.
Aye.
Gaurav,
Aye.
And they
Joel?
don't care. You can just, even
Right.
if they gave you more than 2 minutes, you can just tell they
Julie?
don't care.
Aye.
Maybe individuals on this group
Sarita?
care, but whoever's leading it does not.
Jessica,
They only meet officially 10
Robin?
times a year
Aye.
Holly,
for a pretty big
Aye.
mandate.
Stuart,
Aye.
Judith,
Aye.
Amanda,
Aye.
Donald,
Aye.
Jessica,
I'm sorry, just give me 1 second, please. I'm just going to vote in consensus with my team on this. Aye.
thank you. Motion passes.
Bad idea,
thank you so
Jessica.
much. The next item on our agenda is also an action
The basic
item.
stuff you
It
didn't
is
think
the
about it.
Rehab best practices. There is distribution of content material, that was in the packet as well. I'm going to call for a motion to vote.
This group seems to be designed to
I make the
not violate
motion.
the Brown Act
Robin?
directly,
Thank you, Robin.
but
Can
to
I have a second?
circumvent it.
I second.
Thank you, Joel. Call for discussion.
Discussion?
Go ahead, Bill.
Is there gonna be a process with this as far as distributing it? Are we also gonna have the opportunity to have kind of a onboarding meeting or opportunity? Or are we just, you kind of give it to them and then the chair kind of discusses any concerns or needs? Not sure what I mean.
Can you phrase it in a different way? Can we say it in a different way?
I think this guy sometimes comes up with good points.
Will there be
He's got
opportunities
concerns.
for onboarding new members with this materials?
I can, add to that, so you're looking to recommend to add this to the onboarding process
Yes,
for a member?
yes.
We can certainly,
Yeah, I'm just concerned that if we give them materials and we just give it to them. And everything's new, so I remember when I was new to the board, there's so much information. Just any kind of support and kind of nurturing through is very beneficial. I don't-
yes, so currently we do go through an orientation with myself, to go over, all of the have the flow, and so we'd like to recommend for it to be, stated on there. You can certainly do that.
See, the issue, it doesn't matter. This group only meets 10 times a year officially, and sometimes they don't make quorums, so it's less than that.
Who would
And
you
they've got a
suggest
huge
to,
mandate.
like, when
And
you
it's
say
all
board member,
volunteers.
Are you looking for like?
So
the
they're
most senior board
essentially
member?
being
Are you
given an
looking for, like,
impossible
executive
job.
Board member, like what are your ideas when you say a board member?
I'm just throwing out an idea because it seems to be more welcoming and comforting. if a member is there, if they choose to be there. And it doesn't have to be a senior, it could be someone newer too. It's just sharing experience and connecting with a new member. That's what I'm,
Yeah, we can, I can. talk
He's
to the
trying,
chair
but they should be
and
meeting
then
once a week at least,
determine
and they
something,
should be
but
paid.
regarding this item, you're good with
yes, I'm
recommending.
good with
They're
that.
trying to hammer a square peg into a round hole.
Okay, sounds good.
Bill,
Aye.
Gaurav,
Aye.
Joel,
Aye.
Julie, I,
None of the
Maria?
documents are available. You actually have to submit a
Jessica,
California Public Records request to get
Aye.
the documents these people are working on. And
Robin,
I'd say the individuals might be nice people here,
Holly,
but a group dynamic has been set up that is
Aye.
incredibly dysfunctional.
Judith,
And nobody is
Aye.
saying the emperor has no clothes in
Amanda,
this group.
I, Donald,
Aye.
motion passes.
Thank you. The next item on our agenda is our favorite item and our favorite time during the Behavioral Health Advisory Board, and that is the director's report. Starring Berman.
Am I the only one who detects zero sarcasm?
I just gave you the most fantastic,
Dripping with sincerity,
it was absolutely dripping with sincerity, absolutely.
oozing sincerity.
Absolutely oozing with sincerity. And you didn't even appreciate it.
I do.
gave
Berman,
you
I
the
believe, the
level
director of
everything.
Behavioral Health
Thank you so
Services
much,
down in San Diego.
Serena. So a lot of what I wanted to spend some time covering is stuff that we didn't have an opportunity to talk all the way through at the retreat. Because we were sort of talking about kind of larger, sort of meta level strategy and approaches to, the board might take to being engaged and getting stuff done. So I didn't talk about some of the kind of pressing policy stuff. That's, an important part of the landscape right now in behavioral health. To give you guys updates on, what the San Diego County, response, is today. And where it, kind of likely will be leading in the next weeks, and months. So I want to spend some time doing that. Before doing that, I just wanted to do, a little bit of, level setting in light of Tuesday. That was a big day, of course, county and beyond, and talk a little bit about some organizational changes that are underway at the County of Health and Human Services. Particularly, like do it very briefly, just to flag those things in case people have questions. And that is in particular Judith's suggestion. So thank you so much, Judith, for raising that. I don't want to do kind of anything like a deep dive around Tuesday, beyond to say that very importantly for us, what emerged is continuity with respect to membership on the board of supervisors. I think that for us is particularly significant because there are items that are long range. There's at least one item that's a kind of long view item that I know we've talked about a lot in the context of BHAB meetings. That was brought forward by District 3, and so continuity there, I think, is important because it indicates obviously that that's the thing that you're gonna kind of.
He's talking about the elections on Tuesday.
Be pursuing. And that is the children's and youth optimal care pathways. I think it's very important.
Apparently, most of the board of
And I
supervisors
just
got
would
reelected.
flag,
So he likes
as I did during
continuity
the
there.
retreat, that I think that that project, that body of work will be, I think it's a really important opportunity for engagement with the Behavioral Health Advisory Board. It isn't just sort of near term and reactive, but it's kind of long view and this board an opportunity to participate really actively in longer range strategy making. So just want to kind of flag that opportunity again for this board's consideration as we move forward. With respect to county bureaucracy reorganization, just want to note that within Health and Human Services, so behavioral health, the Behavioral Health Services Department sits within the Health and Human Services Agency. which is now led by Kim Giardina, who has worked for the county for many, many years, and most recently as the leader of the Calhoun Family Wellbeing Department, which also sits within the agency. So she is now the deputy CAO, leading the Health and Human Services Agency. And within that agency, there are two kind of recent changes afoot. One is that a department, actually relatively recently become a department, grown into a department, remaining division, which is called the Medical Care Services Department, is going to be merged with or folded into the Public Health Services Department. The Medical Care Services Department historically had been the host for county EMS. That was one of its kind of most significant direct service or operational functions, was to be the seat for county EMS activity. That a couple of years ago moved over to Public Safety Group. Medical Care Services since then has mostly been devoted to managed care plan related policy work. So they've been very active participants in Healthy San Diego, which is the convening of managed care plans. And they've been very involved in sort of tracking what's going on with Cali. So active engagement with a local MCP or managed care plan network, but then also doing a lot of tracking of what's going on with Medicaid reform in the state of California, trying to sort of suss out what it will mean locally and what opportunities we may have locally to engage in advocacy in making, potential changes to it or adjustments around it. So there's been a component of the Medical Care Services Department that is called SD-AIM. You'll hear the reminiscence to Kelly in that title, and that's most of what that includes. So that's being folded into Public Health Services, presumably to sort of pursue the same functions, basically. The other change is that
reorganization of the County of San Diego,
the Homelessness Solutions and Equitable Communities Department, is being sort of disassembled, and its various capacities are being pushed into other structures within Health and Human Services. So the Homelessness Solutions piece of that, and a lot of the work that component of HSEC, that's what we call it. That's what we call that department when it wasn't field department when it was first together with HSEC, HCEC. The Homelessness Solutions piece of that is being pushed into a department called HCDS, so Housing and Community Development, right? That is a department with statutory authority in the County of San Diego to be the housing authority for the unincorporated area. So HSEC didn't have statutory authority as a department. It was a kind of a recent creation over the last number of years. And so that piece of it has been pushed into a part of Health and Human Services that does have that statutory authority. The work of Homelessness Solutions, though, importantly, will not just align with the unincorporated areas, which is really where the lion's share of housing and community development work has been focused. It will continue to reflect a county-wide focus, and a lot of the work that office and HSEC has been devoted to has been like safe parking, kind of encampment remediation, I guess we could say, and homelessness outreach generally. So a lot of that work sat there, and presumably will continue with this sort of like departmental reorg. Let's see, the Equitable Communities piece of HSEC now sits within the Office of Strategy and Innovation, which is a relatively small office within the executive component.
He's not saying why any of this
of
stuff
Health
happened.
and Human Services. A lot of the Live Well work that you might have seen, the Live Well Advance, for example, which is this quite large conference that's been staged annually for quite some time, and that is coming up on the
I don't know
21st
what
of
this
this month,
Live
actually.
Well thing is.
That is put on by
I think they
by
got
the
funding
Office
for
of
the
Strategy
Forster and
Innovation,
Testing
and then it does
program.
some kind of, it does various sort of strategy making
Family Healthcare Centers
work
of San
for
Diego.
health insurance.
Used to train
That's where
people.
equitable communities is gonna be set. The expectation, as I'm understanding it currently, is not that that this should reflect changes in capacity or focus so much. But it's not insignificant, I would say still, and is something that you would probably hear about otherwise, and so I think important for us to anchor to it in this setting. And I'm happy to answer questions about any of that stuff when we get to that in a few minutes if people want to talk about that. With respect to the policy landscape, I want to talk a little bit about where we are with Prop 1, which continues to have these two important components, and so I'll talk about them one at a time. I want to talk about a really significant waiver that I think we haven't discussed a great deal yet in BHAB. I may be wrong about that. It may be a thing that we've talked it is certainly a thing that we'll talk more and more about over time. So I want to make sure that everybody's introduced to that so that we can be tracking it in conversation over time. And that is called BH Connect. And it is among things that are being driven by new approvals from at the federal level. Right? This is a lot of what the Medicaid reform work, the Medi-Cal reform work that's happening now is being driven by requests for approvals to do things differently at the federal level. Those requests happen in kind of through things called waivers, primarily what are called 1115 waivers. So a lot of payment reform is super significant in the context of CalAIM, the establishment of a 90-day pre-release program. You guys have heard about that in partial settings, extremely important. That happened through an 1115 waiver. This BH Connect thing is also happening through an 1115 waiver that is not yet technically approved by the federal government. We expect it to be approved. I would opine maybe we especially expect it to be approved before January. I guess I would say they're probably feeling some pressure around that. And it's massively significant. BH Connect is for the broader world of behavioral health. I know some of you.
It's massively significant. Why are we just hearing about it now?
I'm not going to review every one. I think it would be important though, and I'll sort of look to Maria and staff here. I think it would be important for us to be pointing members of the advisory board to BH Connect materials so that you guys can familiarize yourselves with it, so we can either get it in packet or make sure that you've got those to it, and then we can talk to the executive committee about making time to talk about this in more detail because it's super significant. I'll just list a few things. For example, does everybody on the board at this point know what the IMD exclusion is? Some people, not everybody. So this is a really significant thing for us. It stands for Institute for Mental Disease. This is part of the founding language of Medicaid at the federal level, established this provision. And what it does, the IMD exclusion, is that it excludes Medicaid reimbursement in sites that just do psychiatric care that are 16 beds or that are, 17 beds or more. It ensures, in other words, that Medicaid money only goes into inpatient or residential psychiatric settings that are relatively small. And for those of you who sort of know some of the kind of history of behavioral health and psychiatric care in this country over the last half century or century, you would understand that that's because Medicaid was trying to sort of incentivize movement away from the massive institutionalization of people with mental illness, right? It was trying to create incentives to do that kind of care in smaller and more community-based settings. What most people kind of in behavioral health policymaking land at this point agree to is that while I think most of us sympathize with what motivated that IMD exclusion at the time, right? Which was like that we should do care in settings that's more humane, that's more connected to communities, that's less stigmatizing. The way that the IMD exclusion functions now is to make access to especially inpatient residential care for mental illness extremely difficult. Because you can't build a big psychiatric hospital as a standalone hospital and draw public insurance money into it. So again, sympathy was sort of what motivated it, but it presents lots of challenges for establishing the number of inpatient and residential beds that we know we need across county, across the state of California, really across the country. There are some legislative efforts afoot at the federal level to have that provision turned over or sunsetted. Those have not come to be or full fruition at this point, but there's been a lot of talk about that. What BH Connect would do in any kind of interim time is it would establish within certain parameters, opportunities to even in settings that are bigger than 16 beds, draw down Medi-Cal in the state of California. Not for everybody, only for people who are in these settings for 2 months or less. That's the approval that the state is seeking through BH Connect. So this has, those of you who've been working in this field or sort of understand the struggle that so many people in this community, so many family members in particular have faced trying to get access to care for their loved ones. This is a big deal because it creates more opportunities to scale behavioral health up more efficiently. It's, one could make the argument that the drawbacks, are still important. So it's, I think there are legitimate views on both sides of this policy question or policy debate. But it's certainly, I think most folks would understand it's significant in giving us opportunities to establish greater capacity relatively quickly. That's like, I would say, the most significant piece in my view of what BH Connect does. But it does some other real sort of show-stopping things if it's approved. For example, it establishes a transitional housing reimbursement, which is very, very innovative in the world of Medicaid funding across the country. Medicaid has been very committed since its establishment to not funding housing. The Medicaid program at the federal level is very clear about the fact that it funds clinical treatment work. It does not fund housing. Over time, I think folks who work in this field, especially folks who do frontline care work and understand the dynamics around housing and treatment, that distinction has come to feel more and more false. It feels more and more to folks who really are kind of understanding this work that you can't fully disentangle the value of treatment from the value of stable housing. Both have dramatic impacts, positive impacts on wellness, and it's undeniable in the data at this point that treatment is way more effective when it's offered to people who are stably housed. It's very difficult to make progress in recovery for people with serious mental illness or substance use disorder, frankly, in treatment when they are struggling with being unhoused or experiencing homelessness over long periods. So Medicaid's been very protective of this parameter. This is like, one of the first moments at the federal level when it looks like they're gonna actually pay for some housing. They're not gonna pay for it over a really long period of time, but it looks like they may pay for it in certain settings. There's an emphasis here on recuperative care, I would say, for shorter periods of time, but potentially up to 6 months. 6 months, 6 months is still transitional housing. This is not Medicaid paying for permanent supportive housing or permanent housing otherwise, but it's a really significant kind of chink in the, in the armor that meant that the Medicaid program has been wearing its funding. And BH Connect enables this payment directly for housing and also and sort of as a part of provisions that would provide other kinds of support. Is my time up? Seriously? Does that thing know who I am? So there are provisions around housing navigation and other kinds of housing sort of location and acquisition systems that are really important. Last thing I'll mention about BH Connect is that it with respect to the IMD waiver component of it, that's that piece that would let us do inpatient residential services in larger settings. There are certain conditions for counties that want to take advantage of that, and those include a number of things. But for example, the establishment at scale of the accessibility of certain kinds of evidence-based practices. So modalities of behavioral therapeutic treatment, the emphasis in particular is on for young people. So certain kinds of modalities of care that are evidence-based practices will be really important capacities for counties that are wanting to sort of take full advantage. Just for example, there are others. It's important for counties to have peer support capacity. It's important for counties to be working towards clubhouse capacity. These are the latter two are particular things for San Diego County. It's way ahead of most other counties, but there's some kind of complicated interdigitation of like, you got to establish these capacities, and if you do, you get rewarded by being able to draw Medicaid into these larger.
He's just talking about whatever he wants.
All stuff that we can return to in more depth.
And none of the people in the BHAB have the knowledge or expertise to challenge him.
There's been so much
or even to say, what are you not talking about?
So much attention on the CARE Act program. None of them hold a candle in terms of scale of significance to BH Connect, or anywhere close, frankly, I would say. So I think just really important to anchor this board to the significance of BH Connect. Speaking of Proposition 1, though, let me just say that with respect to its two sides, there's the bond B-chip side, that's the infrastructure money, right? So, and you'll hear me and maybe others in this room reference that as bond B-chip. You're like asking everybody to repeat it with me, but I won't. It is a thing that you'll hear, so I do want you to try to like just remember that phrase, so that because otherwise I'll describe it in 100 different ways. So we are starting to hear from community-based organizations about interest in pursuing that. I would just note that there seems to be very broad interest among lots of parties in using that funding to establish additional treatment capacity. The first round is devoted just to treatment capacity. And so I think that's the sense I would want to convey to you all. It's just that's very positive. There are a lot of different entities that understand what this funding is for, that have already taken steps to have initial consultation with the state, and that are seeking opportunities to land this here in the county. So I think that's really wonderful. And then with respect to the other side of one, which we call the BHSA side, Behavioral Health Services Act side, which is way more complicated, I'm afraid. I will just note that we in Behavioral Health Services are continuing to analyze what we think the likely impacts of those changes will be. And so Assistant Director Cecily Goldman Stearns and her team have done a lot of work to try to map, well, we get funded through these components of MHSA, these programs get funded, how would those programs fit into the components of BHSA, given those differences, et cetera, et cetera. So we're doing a lot of that kind of looking at things, and that'll continue, and we'll be sure to apprise the board as we sort of have significant insights as that work continues. a really important piece of BHSA is reporting to the state. So that's also a thing that we are working on developing capacity for. That's a new kind of reporting. It's not just reporting on how we spend, and this is really important for BHAB and how advisory boards are kind of noted in the statute and empowered in the context of BHSA. The Behavioral Health Services Department has an obligation to report not just on BHSA funding in the context of this statute, but on every cent that comes into the county that is meant to be devoted to behavioral health services. So the reporting that we now have to do needs to roll up realignment. It needs to roll up block grant funding. It needs to roll up BHSA funding. It needs to account for drawdown funding. It needs even to include general purpose revenue. So any purely local funding that has no connection to like necessary tie to, it's fully discretionary, right? Unnecessary tie to behavioral. So that reporting work is gonna be brand new, and we've done stuff similar to it, but this is just like a different scale. I think it will be really, really interesting. I think it will be really important for this board to seek awareness of the details around that, and to make sure that that you as a body are staying very threaded to us as a department and how it is that we're doing that and how it is that we are conveying that to the department. SB 43 really quick. We just had, when was that, Mike Phillips, 2 days ago? 2 days ago, we just had our most recent inter or cross-sectoral convening. So a lot of people, including Mike Phillips, very importantly, because he co-chairs the thing, were in the room participating. The news from that, I think, is very good in terms of the progress that we have made in readying ourselves for the flipping on of new criteria in grave disability, including suspicion of severe substance use disorder. We've been working across the domains that we've talked about in this setting before. So training is the thing that Mike Phillips can speak to in most detail. We're doing tons of training. I think important for the board to know that Mike Phillips from Jewish Family Services, whom I will tell people who don't already know, is the county's patient advocate. Also, he is very eager to do more trainings and is very responsive to bodies or entities that would seek more training. So as you are staying connected to your communities, that's a really important thing, I think, to be aware of in light of SB 43. That you see, Mike, raise your hand, Mike Phillips. For those of you calling in, Mike Phillips is wearing a lovely button-down green shirt today, and the same spectacles with which you.
The camera can't see them.
Yep. Yeah, I think to the extent that this body sees itself as a significant conduit between the county and community resources and capacity, this is kind of the thing about SB 43 right now, is that Mike Phillips has been conducting these trainings in clinical settings and community settings all over the place, and so is available.
SB 43 is alarming.
Sorry, Jim.
It is allowing
we'll get to questions.
Psychiatrists nearly godlike power.
People know that the county board of supervisors devoted $15 million to efforts that we would make to kind of bridge gaps that we imagine being significant between necessary services in light of SB 43, like substance use disorder treatment in locked settings, and regulatory policy and reimbursement practices that would sustain that kind of work, right? The state hasn't made that stuff yet. They haven't made the regs or the reimbursements yet.
This is pearls before swine.
To support that kind of work. So our board, recognizing that, has stepped in and devoted these funds. So like we have plans for that money. We've been busy amending contracts to establish substance use disorder capacity in places like crisis stabilization units. We've been bolstering medical capacity across the substance use disorder treatment system. And we sort of stand at the ready through amendments to support substance use disorder care in inpatient psychiatric settings, which is a very significant thing.
This should have been more of a bullet point summary.
But we are still pushing like crazy to get policy changes made that we know need to be made. And so Senate Bill 1238. We talk a lot about
Not
more
familiar
about that
with
into the future. Senate Bill 1238 is cleanup ledge to SB 43. That really significantly gives the Department of Healthcare Services a lot of authority to make new regs and to develop reimbursements. And so it doesn't direct DHCS to do specific things, but it gives them authority to do the things that we hope they will do. So there will be a lot of ongoing local advocacy, and we will certainly seek the partnership of our hospital and healthcare systems. I see UCSD representatives in the room, for example, that kind of advocacy coming from the county, but also definitely coming from
Boy, are they in bed with
healthcare and hospital
UCSD.
systems will be really significant to get in DHCS to do the specific stuff that we want them to do to support the kind of work that we know is necessary. Again, I've said this before in this setting, our sort of like, you know, dream state for where the regs and reimbursements would be is that there would be no difference between reimbursements for substance use disorder care and reimbursements for mental health care otherwise. And that kind of care could happen in whatever clinical setting people have presented to, right? That would reflect how we talk about ideal access to care, no wrong door, equity, our ongoing fighting against stigmas of various kinds attached to behavioral health. That's what we.
I would like to know about your fighting against
It's going to
stigmas.
be.
I think this is where they come from.
This is a fight that's going to take a while.
This is the source.
To reference a code phrase, but I think it's going to be an important. Okay. CARE Act, I'll end with references to CARE Act. CARE Act program continues to hum along in San Diego County at the very modest pace that it's designed to hum along at. You know, I talked about this at the retreat a bunch, but for Donald's benefit and benefit of anybody who wasn't there, we have twice as many care agreements, for example, in San Diego County as in all other counties combined. We're around 1,500 participants. We've been doing a lot of work in our version of the CARE Act program. We've gotten a couple of folks who have graduated already. The outcomes seem really good. Most exciting for me about the CARE Act program work isn't in the numbers. It's not capturable by the numbers, though. I think it's capturable probably through qualitative data ultimately. And it's about, we talked about this in the BHAB specific CARE Act communities as well. It's really about the nature of the dynamic for most people who are choosing to engage with it. That it does feel like it's really empowering. And I'm not meaning to suggest that that is true in every case. But it seems to be a sort of prevailing experience for a lot of folks that it is a very, and that's kind of counterintuitive, and it's frankly not what I expected. I was in some ways a CARE Act skeptic as we headed into it. I was worried in particular that the involvement of courts, public defenders would make it particularly disempowering for people. And so I am very gratified for that it seems that about that, similarly to lots else, I was dead wrong. And so but I'm eager and excited for us to continue to understand how that dynamic happens. There's a little, I think there's some kind of mysterious alchemy in that that we're still trying to understand. I'll stop there. Thank you so much.
Please turn any time to the side if you have any questions. Ms. Judith.
I have two questions, but they're totally related. number one, and I know you don't have a crystal ball, oh, before I even get into that, this was a wonderful, well thought out presentation, I appreciate it. And Sharon, you did, good job.
Thanks.
I know you don't have a crystal ball, but when it comes to feds making these many changes that you outlined, politically, I bet everybody is very concerned that that's just not gonna happen after January.
I meaned in a way that was as politic as possible to suggest that. In the remarks that I made.
And this directly relates to SB 43, because so much of SB 43 also requires that we're more successful than what we have been in changing, state policy, and so I guess I read in our information, we have that item, we updated for readiness for SB 43. I don't know if everybody had time to read that one because it was back, under informational item. But I must have put, I don't know, 5 or 6 question marks in places. And I don't mean it to be critical. What I mean it to be is you didn't get a fair shot at having enough time to get ready for 43. I don't think that's too apolitical. I mean, politically, we know what happened. It didn't help you. It didn't help. I don't think it helps our community. I don't think we're going to be as ready as we'd like to be on January. And again, not being critical, it's more like setting expectations.
Yeah.
But it just, I saw so many things that, well, it might happen by something, 25 or 26, or it was just so much meat and material in there that might lead some people to think, oh, we're ready to go. And I'm kind of looking at my buddy
They're
down
messing
there,
with the
Mike
Constitution.
Phillips. I just think we've done a great
With SB
job.
43.
I think our interagency
They're
work has
giving
been
psychiatrists unbelievable
unbelievably good.
power, as if they didn't already
But
have enough.
what should we be expecting in January 2025?
Next, yeah, great question. I also don't have a crystal ball, of course. Maybe that's what you said. You said, I know you don't have, yeah, well, you're right. I do not have a crystal ball. I'm pretty confident, though, I would say, that it is not gonna be calamitous. It is not gonna be anything like a catastrophe. And a lot of the sense that I have for that is through what has been, I think, a very sincere, active and constructive involvement of law enforcement in the cross-sectoral readiness work that.
See, they only
Mike
pay
Phillips
attention to
and
people
Dr.
in the system.
Zito
They pay
have
much
been
more
doing.
attention to that. There's
So
almost a
San Diego
hierarchy.
PD and the County Sheriff's Department have been particularly active in that setting. Chula Vista, I know, has been there, and some others as well. And we've had participation from those from those representatives of the peace officers in the language of SB 43, that's been close enough to the ground that really is able to reflect on the actual experience of putting a 5150 hold on somebody and how complicated a thing that is, and how much needs to be taken into consideration quite quickly in making a decision to do that. And what I've seen is kind of almost, I would say, like a hallowed respect for the significance of that move among the peace officers who have participated in this work, like a real sense for the seriousness of that, for the significance of that not being political and not being motivated by municipal political leadership or county political leadership for that matter. This is really about, sort of the interface between a person who works in law enforcement and a person who
And for
needs
good
help.
reason. That will affect the rest of their lives.
And I imagine this is true of Mike
And the
Phillips,
problem
maybe
isn't
not, or
the
Sharon
present,
Stone
it's the
disagreement,
future.
but, I have really felt that in those settings, and I would say nothing has been more reassuring to me than I mean, there are all the sort of like quantifiable metrics of our movement towards readiness and boxes that we've been able to check because we sort of made contract amendments and gotten trainings out the door and that sort of thing, but knowing that peace officers take this incredibly seriously, that they don't see it as a tool for addressing homelessness, that they see it as, you know, as something that needs to be thought about as very, very distinct to each case, has been very gratifying. And the word that we've been using is like judicious. We are confident that peace officers will take a judicious approach to this opportunity to help people get care, and get services. So I think the numbers are gonna be relatively modest simply because of that. So that I think is most significant. The other thing I would really emphasize in particular for folks, who may be listening in, or who are in the room representing health and hospital systems, is that the crisis stabilization units, I think, will be very significant. And there may just be like maybe a sort of lack of credulity about that among some of those, you know, some of those parties. But I just want to say that we do have access, we do have capacity in our crisis stabilization units. And the state, this is an area where the state has really kind of leaned in more. They know crisis stabilization units are going to be useful for 5150 transports, maybe in particular in the context of SB 43, where there will be a disproportionate number, I think, or percentage of 5150 holds that get dropped pretty quickly as people's intoxications. So I think, and I would just say San Diego County has done a huge amount to lean into crisis stabilization units and pairing them with MCRT. So it's an area just to because the comparison to San Francisco is made all the time because they went right away. They do not have CSU capacity. It is not a thing that they have leaned into as a part of their kind of continuum.
But we haven't solved some of the payment issues, no fault of the county. This is a state issue. And until we can see, until that open door is for the person with substance abuse as well as mental illness, the people who provide those services and CSUs are still gonna have one hand tied behind their back.
They will, but there are opportunities in CSUs for CSUs to use a period of time that they would code as assessment, where it wouldn't need to be clear whether there's a mental illness presented to them or a substance use disorder. And the state's been pretty clear about this, that like that assessment period is really significant. People can't stay in CSUs for 72 hours anyways, right? So CSU is an opportunity for, I think in the context of SB 43, for intoxication to clear, for an opportunity to interact with somebody who is better rested than when they presented, who is less intoxicated often when they presented, and to drop a hold and navigate them to ongoing care and to be paid for it. Just like if they were working with somebody who had who came in with a mental illness. But so just to say that's true in CSUs. I agree with you, of course, and it's a point I was amplifying in my remarks, Judith, right, that the state needs to, they need to do a lot of work. And the thing I would like not to see is the establishment of a parallel set of reimbursement mechanisms for substance use disorder that continue to impoverish the field of substance use disorder treatment. That's the thing I would ask. Thanks.
Really understand.
Thank you so much, Dr. Bergman, for your presentation and your great questions. Unfortunately, we have to move on to stay on time.
We do have, we have 10 minutes left.
Oh, we do have 10 minutes left.
Sorry, Sarita, but we have 10 minutes left.
Well, now we have.
Well, I didn't know. Nine.
How about that? I just want to bring out that Robin and Jessica are also want to.
Okay,
Their hands are up.
okay. Okay, Rob, go ahead and then we'll go to our Zoom comments. Rob, go ahead.
Just really quick, does this impact in any way the criteria that MCRT and PERT are looking at when they see a patient? like the criteria for which they would bring somebody to a hospital?
So to the extent that they are observant of uh, detainment and transport for care policy, absolutely. Yes. Just like any peace officer, yeah.
Do Jessica or Robin have any questions?
I have my hand up.
Who was that?
Thank
Robin?
Okay. Yes, thank you, Sarita. Dr. Bergman, I was, this is to everybody. I was very fortunate to be at the SLASH collaborative meeting earlier this week. And I'm also very impressed with the progress that's been made. One thing I heard from law enforcement is that
Robin,
can you hear me?
not very,
No,
not well.
can you
Okay.
slow down? Can you enunciate?
How can you hear me now?
Much
Yes,
better.
but can you enunciate as well?
Enunciate, please.
I will try to enunciate. Okay. So what I think, I was very fortunate to be at the collaborative meeting this past Monday. And one thing I heard from law enforcement, and which made me happy, is that they will be relying on MCRT to help with the assessments. And this was our concern when we started last year, that perhaps untrained law enforcement who have very minimal mental health
Licensed
training
clinical social
would be
workers, I
making
don't know if I
decisions,
trust them more than cops.
that really they're not capable of making or trained to make. So I was very happy to hear that they were going to be using and relying on MCRT. And so my question has to do with, once that SB 43 rolls out and we find that there is an increase in utilization for SB 43, will their contracts be augmented?
Great question.
Whose contract she means?
I cannot say for certain that, what would happen with, with the scale of contracting for MCRT or for HERT. I think most people know that, that we are in the midst of a pretty significant, or we're anticipating pretty significant budget deficits at the county generally moving forward. So I would have to be cautious in how I respond in this kind of public venue, especially to that question. But I would say, of course, that we will continue to aim, as we have in behavioral health services, to make decisions about the, the contract-driven investments that we make that are most strategic, and that we of course want to be supporting things that we know are working, and we want to be scaling things further when we know there is additional need for them. I would answer it that way at this point. Thank you.
Jessica, do you have any questions?
Yes, thank you so much. And thanks everyone for speaking louder. It's really helping me engage. So I have two areas that I'm hearing and wanting to respond on. One of those is that we have a pretty consistent theme going here in terms of there not being any discussion about the Americans with Disabilities Act interactive process. We have no discussion about budgeting, training, or hiring the right individuals to be able to engage this population in that ADA interactive process. We don't really have a discussion of policies and procedures for ADA accommodations during this process as required under federal and state law. And in the education and training, there's also no mention of how law enforcement officers are also obligated to accommodate people under the Americans with Disabilities Act in their interactions with them on the streets and in the jails.
See, these are all secret documents. So what you say might be totally valid.
There's no mention of the Senior and Disability Justice Act as being part of this engagement process, which really puts those with speech, hearing, and communication disabilities and those with medical conditions most at risk in this process. As for the CSUs, us relying more on them, we already know that they are currently coded to be 20 4 hours or less, not 72 hours. So if we're going to be relying more on the CSUs, are they going to be set up to be able to do 72-hour holds? Will there be a way to lay down? Will the individuals there have to be on the floor in order to lay down like they have to right now under fluorescent lighting? Will they get pillows, which they don't get now? And how are you going to get the CSUs ready? Thank you.
Thanks. Let me address the second question first. So there is understanding, of course, that CSUs are, and I think I mentioned it a moment ago, CSUs are not meant for stays of over 23 hours and 59 minutes. So we would anticipate in cases where they are a sensible initial point of transport in the context of a 5150, if there's ongoing need for evaluation, if there is need for maintenance of the hold, that folks would be moved to different settings so that we don't face an overstay in the context of a CSU. The reason that I think we won't see very high volume cases like that, again, points back to my expectation, at least, that a kind of disproportionate relative to current state number of holds will be dropped relatively quickly. They'll
I believe they signed the 72-hour psychiatric holds.
Because again, with SB 43, there's this very significant change, which is consideration of the possibility of severe substance use disorder, driving grave disability, and I'm imagining that in a lot of cases, it will be visible or perceivable, in any case, intoxication that's going to lead to a hold, given that change, and that as intoxication clears, that it's very likely, this is my sense from talking to a lot of other clinicians, that holds will get dropped. So very good question, Jessica, thank you for it, and I think really important for everybody to understand that it's that it is absolutely right. CSUs are not designed to hold people for 72 hours. We don't anticipate that. The first question was about ADA emphasis. I think in Jessica, you were using the phrase "this process." I think you mean when you say "this process" that this one is the whole process.
I'm just discussing the readiness for SB 43 and the ADA interactive process. A lot of people don't know that the ADA interactive process is when people talk about compliance with the ADA, it's called the ADA interactive process. Thank you.
Great, thank you for clarification. So really important point. I think again, the co-chair of that committee, Mike Phillips, is sitting in the room right now. I will convey Jessica, the point that you're making to Dr. Paul Esposito, who is the behavioral health staff.
The stated goal of the Behavioral Health Advisory Board is to implement
and we'll make
Bill
sure
43.
that point gets considered. Thank you so much for raising it.
Thank you so much.
Thank you everyone for your questions. Unfortunately, we will not be able to get to everyone's questions. Apologies, Amanda, that we weren't able to get to your question. Thank you so much, Robin and Jessica, for your Zoom questions. We will be moving forward to our next agenda item, which is including questions or comments, which will be the prior items that we covered in our meeting. If anyone has any questions or comments about the prior items that were mentioned in the agenda.
Thanks for the presentation of the director's report, and thanks Mike Phillips for doing the education component. I'm encouraged by it. In the packet this month, I didn't see the Optum data report out that I really like in terms of the trends and what we're seeing across the county. And I want to acknowledge that with SB 43 and the work that the county's done in terms of getting the word out about 988,
and alternatives to law enforcement response for, behavioral health crises. That as implementation goes into effect in January, that we're also watching trends and ensuring that there isn't a backlash in terms of stigma of utilization of 988 and MCRT. And, because of SB 43, and I think that that comes a lot with education and expectation setting that JFS is doing to get the word out there. So, as we see implementation in January and move forward, if there's a way that, that I can be supportive in anything that I can to really look at some of the strides we've made in 988 and alternatives to law enforcement and getting people to directed care in a non-stigmatizing way. I'm really interested in making sure that that happens and appreciate the work and the positive, encouraging outcomes from CareCore and others.
Thank you, Amanda. I want to add something. The data dashboards that we usually provide in the BHUB packet are not provided this time around because they are transitioning into a new system. And so we will provide them though in the next BHUB packet.
Thanks so much, Amanda. I did want to clarify on something that was placed in our packets, which was the distribution for our content materials. So, Bill had touched on it a bit earlier, but for the distribution for content materials, this is for something that when we're doing emails or things like that, if anyone wants to share any type of material via email, this is what this is for. Just for clarification, when we're talking about the distribution of any type of materials, whether it be political, whether it be any type of opinion pieces or anything like that, this is what this piece of paper is for. These are going to be our best practices for distributing any type of material like that. So just in case there was any type of confusion or if anyone needed any type of clarification for what this piece of paper is, that's what this is for, any type of electronic distribution of any type of opinion pieces or any type of articles or things like that. Does anyone have any questions or comments?
I don't know what she's describing. Some kind of internal newspaper of some kind?
Going once, going twice. Fantastic. Are there any other questions or comments? Rob, he changed his mind, bye. Bill, come on down, you're the next contestant on questions and comments.
Two things. You mentioned MCRT and stigma. It was pointed out to me from some consumers, it's unintended, but some of the vans and vehicles have MCRT, so when they come to the house, they are concerned about neighbors' perception. And that's a unintended stigma, but it was pointed out to me, and when you bring it up.
That's a good point.
I'm sure that, just to be aware. And
One more, go ahead.
So, I just wanted to share something, because I'm on the state CARES Act work group, and Luke mentioned about the San Diego CARE Act, but I think he understated it. Like, the CARE Act, Amber Irvine is a rock star in the state. There's counties who are gonna be implemented in December, because we're in cohort 1, that are contacting her regularly because they created something out of nothing. And the success and just the impressive numbers and the ability to continue to grow is just, in the state, is just overwhelming. And she did a talk yesterday to share some of that knowledge, but people don't realize how difficult it was just to create it and to be successful, and now to share and implement it to other counties that are in great need of a foundation. The county did a great job and she's amazing, but it's still early. That's what I wanted to point out. It's only been a year and it's been successful as a start, but now she talked about how they're hoping to use first responders because they're in contact with a lot of consumers and stakeholders. And they can hopefully do petitions in the future. So I just wanted to point out, there's a lot of more advancements and possibilities to continue the numbers and the success.
Okay, thank you, Bill. Okay, that concludes questions and comments. Moving on to our next item on the agenda, which is the chair's report. And I will be talking about the fall retreat and our subcommittee's chair's report. Really quickly for the subcommittee's chair's report, I believe Robin has a chair's report or subcommittee chair's report for us. Robin, are you here?
She was having trouble with connecting, so we're gonna have to come back.
Okay, we will be coming back. Going back to the retreat, most of us were there for the retreat, and the retreat was absolutely fantastic. We did have a very rousing conversation about some of the goals that we would like to have for the the advisory board, which we did not exactly come to a we didn't exactly come to a conclusion for that, which is okay. For this Friday, there's going to be a subcommittee determining the priorities for BHAB. If you would like to know more about that, please let Maria know. Maria, did you want to kind of expand on that a little bit?
Yeah, so we're meeting on Friday. Last retreat, at the retreat, created this subcommittee to work on the priorities. And we are meeting at 2 p.m. So if you are interested, please come by right after the meeting and I can always add you.
So she's talking about the retreat they had.
Anyone else have any questions or comments about what was discussed at?
I don't know how they got around the Brown Act on that. That's a private meeting, or maybe it wasn't. But for all practical purposes, it was. And it sounds like they had some rousing discussions about something.
Moving on to our next item on the agenda, which are announcements. Julie, I believe you have an announcement for us.
Sure, I have a flyer and I'm with East County Transitional Living Center and we're gonna do kind of an open house guided tours, so you can see our facility. It's 340 beds, 80 individual homes for families and two-story large dorms for singles. So not everybody knows about it, so I thought it would be fun. So it'll be Christmas themed, food and drinks, and you'll be taken around to see what services we have, both our services and our community-based partners that are there too. Thank you.
Thank you so much, Julie. And those flyers are,
She distributed it to everybody, so they should be sitting there. I have more if anybody wants one.
okay, fantastic.
Unfortunately, it's the same day as our board meeting.
Well, I haven't looked that far yet, so, okay, here we go.
Okay. It might cause you some conflict.
Yes, yeah.
Is this your website?
Thank you so much, Julie. Really appreciate that. And you never know. So, but I appreciate that you have that event going on. So thank you so much for letting us know about it. And I know that's not it, Bill. Don't get excited, okay? Still have something else left. There was something that was in your packet. It's called the Fall Retreat Post Survey. Please make sure that this is filled out and that it is handed to yourself. Okay, that is also handed to Maria. This is very important so that we get feedback on the retreat so that we know what needs to be improved, what needs to be done. What we can do to obviously improve the fall retreat and get things going into the correct direction. Now we're done. Can I get a motion to?
I wanted to make an announcement.
Oh, you have an announcement. Oh, I did not know you had an announcement. That was not, Bill, you have an announcement?
Sorry.
Oh,
So, it's probably growing up at your retreat, but I do want to acknowledge, Stuart, who's been the co-chair for the substance use prevention, is stepping down. But I do want to acknowledge the participation and all he brought to the SUP, and yes, he's gonna be missed, and he was a valuable member And we appreciate, or I appreciate, and I know everyone who attended, appreciate all that you put into it. And thank you.
Thank you so much, Julie, and I would also like to take the time to acknowledge and appreciate that as well.
I have an announcement as well.
But
So I would like to invite everyone on the BHAB and anyone participating in the meeting to please join the Committee for Persons with Disabilities, the County Committee for Persons with Disabilities meeting. It's once a month. It's the third Wednesday of the month, and you can find the link to the meeting and our past meetings on the County Committee for Persons with Disabilities website. We do have a standing item around disability rights and behavioral health, and we're currently working on recommendations to ensure that there is, hoping that there will be an ADA interactive process for all people who are referred into behavioral health services that have disability accommodation needs. And we're hoping that will be a supportive and ongoing interactive process. And it's a really great meeting. So I would love if anybody could make it. Thank you so much.
I might
thank you so much, Vice
try to
President.
live stream
Anyone else
that
have any
one maybe just to
announcements?
learn, because I don't know that much about it. But you have no rights in mental health. Clear that one up right away.
Just making sure.
Your rights go away instantly.
Ms. Judith?
Once you ask for mental health, you lose all your rights.
Can I get a motion to adjourn? Thank you, Rob. Can I get a second? Second. This meeting has been adjourned. Bye.
Okay. I don't know if this video streaming even worked, as I said, I did just to learn. Didn't learn that much from this meeting. Luke Bergman's presentation was, it was just him doing what he wanted. I, for example, wanted to know what happened to that outreach thing. UCSB Health gets to prance around disadvantaged communities. But anyway, if the meeting is officially over now, so I will close this and close this out. I hope I get to. I hope this works. So that maybe I'll put an edited version of this up. I'm not sure yet, but I certainly botched the whole first part of the meeting. And this just to see if this technology has potential for the future. The video channel I'm streaming this to, only at my video channel only has 20 users, so no one came, and the odds of anyone coming were kind of infinitesimal anyway. But again, I just wanted to learn it.